In this video, I'm going to be talking about the macula within the retina and plaque-window toxicity. So what does that even mean? So for some of you that might actually be taking the medication known as plaque-window, hydroxychloroquine, chloroquine, different variations of the drug like that for different autoimmune conditions, cancers, different things that physicians will prescribe this drug for, there has been a historical noted association with that drug and affecting the macula, which is your best center of vision for looking far away, reading up close, driving, anything like that. The macula is composed of a bunch of photoreceptors. It is extremely dense and it is your best detailed quality of vision, especially when detecting high detailed things, reading, seeing, everything like that. Many years and many decades ago, there were certain amounts of plaquenil or the certain drugs associated with it, like hydroxychloroquine, chloroquine, that were prescribed in too high of amounts that has led to certain people over time, over decades, develop like a breakdown in the macula. And this has been studied, this has been researched. There's tons of studies out there that indicate that yes, there is a little bit of a chance that some folks can develop this over the course of time. But what physicians have found out in collaboration with optometrists and ophthalmologists is that if they were to scale the amounts of the prescription drug back to the correct amounts for like per milligram per kilogram of weight, that it actually dampens and significantly decreases the chances of developing macular toxicity from plaquenil. But it's still extremely important when you see your eye care professional each year, optometrist, ophthalmologist, to get the visual field exam, to get the OCT retinal screening, to get the fundus photo, to get the different technologies of testing and evaluation to make sure that your macula is still intact. Checking the vision, checking the health, checking everything. There are certain visual field requirements and there are certain OCT, optical coherence tomography evaluations, as well as fundus photo evaluation to determine if the macula is indeed breaking down or not. But if it is breaking down, it can be associated with certain things like macular degeneration. For example, this can look like central vision loss. This can look like things getting blurry. It can be a whole variety of things from what you can experience. As time has gone on, the more I talk to folks, the more I talk to physicians about the amount of plaquenil or hydroxychloroquine that they are on right now. It's extremely low that I've seen it over time, but it doesn't mean it doesn't exist. It's still out there. It can still cause problems, which is extremely important that you see your local eye care professional for your routine annual eye exam. And if you are on plaquenil, to talk with your eye care professional as well as your prescribing doctor about what's going to be best for taking care of your eyes, whether you need visual fields twice a year, once a year, OCTs once a year, twice a year, whatever the number is that you and your physicians determine is going to be the best course for your health, to be more proactive on things rather than reactive. Because once that macula breaks down, it's really hard for it to come back, and there's not much you can really do once it does break down from the regenerative standpoint. It's not like another regenerative organ like the liver, to where if there is a section of it like missing or taken off, it can kind of regrow itself. It doesn't really work that way with the macula because it's too detailed and too precise and has too many nerve endings, and there's not any regenerative capability. It will use other photoreceptors in the area, but not to the extent that you once had. So it's extremely important with some color testing, visual field testing, all the different tests that your eye care professional is going to recommend for you, as well as your prescribing physician in collaboration with one another to make sure that you get the best visual results you can. So this is an important message. If you're taking the medication, if you have the condition, whatever it may look like, please talk to your physicians. Let them know. Ask the questions. This is what we do. This is what I do. I love answering questions from folks. It gives me joy and satisfaction to continue learning. I don't have all the answers, even if they were to ask me the questions, but I like to go learn in the event that I don't have the answers or ask someone smarter than me, because that's what we're about in the eye care field, or that's what we should be about. It's about learning, taking care of folks, and passionately serving those around us. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications. I'm Dr. Bryce Heffington. We'll see you next time.